Hello, MedTech Insight enthusiasts. This is Dr. Jennifer Joe with my co-host, the fabulous Dr. Omri Bhatt with MedTech Insights. When Dr. Bhatt isn't hosting this show, she's running the Massachusetts General Hospital telecardiology program, seeing congenital heart disease patients, and teaching at the Harvard Medical School. Omri, you do so much. When I'm not hosting the show, I see patients in the emergency room, urgent care, and hospitalist setting. We both support a number of traditional medtech and up-and-coming digital health startups. We believe that healthcare can be better, both for the clinician and for the patients. You can find both of us giving local, national, and international talks regularly, and you should look for our Springer first ever textbook on digital health to be published very soon. Yeah, we've been working a lot on that. MedTech Insights is a live weekly interactive talk show led by me and Ami, where we interview two guest leaders in digital health every Tuesday at 12 noon Eastern Time. It's a little confusing how this works. You can watch us live every Tuesday at 12 noon Eastern Time through the MedTech Insights Facebook page, either Ami's personal page, my personal page, Facebook pages, the Vanguard.Health YouTube page, and through my personal LinkedIn Live page. When you turn in live and write comments in any of these places, we are able to feature your questions on the show, and we'll try to incorporate your questions to our guest. Again, we love when you comment, so please comment, introduce yourself, tell us where you're watching from, and tell us a little bit about what you're working on, and also clearly if you have any questions for our guest. All shows are recorded and available after the fact at our website, Vanguard.Health/MedTech Insights. Be sure to keep up with the show by joining our mailing list. Look for us on LinkedIn, Facebook, Twitter, and YouTube.
Fantastic. Hello, everybody. There has already been a ton of discussion online about today's guests, so we will bring them on shortly. Our goal today is to talk about the future of pharmacy. We're going to talk about all of the fancy ways that we're going to be able to have so much more control as patients over our own drug delivery and ways that it's going to make it easier for us as caregivers, as nurses, as physicians, as pharmacists to be able to interact with our patients and really empower the patient to kind of be involved in their care in a way that they're involved in the rest of their life. And so we're really excited to look at the future of pharmacy today. I didn't know about this thing called digital companions. I am learning all sorts of new stuff. So this is going to be a new topic. I don't know who else out there knows about this, but I think that's going to be really great in talking about pharmacy. We do have to address what is happening today, I think. At 8:30 a.m., I got all sorts of alerts from all sorts of directions about the Johnson & Johnson COVID-19 vaccine. And so there is a lot of movement going on right now between the FDA and the CDC. This is kind of similar to the story that has been happening with AstraZeneca. And please know that they are convening yet another group to meet tomorrow on Wednesday to get more information. I would like to reassure people, reach out to your physicians if you have questions. Reach out, of course, if you have symptoms, but this is still a very rare occurrence, the occurrence of blood clots in the setting of the vaccine. It is still a very rare occurrence. Everybody is doing the due diligence because this is new. So I know many of my patients are calling, and if you're seeing me right now, I am going to get back to your calls this afternoon to be able to talk about your individual cases and reassure you as needed. So with that in mind, I think this is actually a perfect opportunity for us to think about what the future of the pharmacy industry actually does look like and how we can get involved as physicians and patients. Just a reminder, everything that both Dr. Joe and I say here are our own opinions and do not represent the institutions for which we work or affiliate. And so with that in mind, let's bring on Omri Shor. He is the CEO of Medisafe, and we're excited to have him come on, tell us a little bit about his own journey, how he got here. And then I think he actually has some great video. I know our audience has said that the videos have gone over swimmingly. So we have some great video of how Medisafe works and how you can maybe get your hands on it.
Welcoming Omri Shor.
Hello.
Omri, so good to have you on with us. Thank you for being here.
That's a pleasure to join you today. Thank you very much for inviting me.
Absolutely. So this is this is a great story, you and Medisafe and what you can do now. So maybe for the sake of our audience, will you just give them a little bit of an introduction as to what Medisafe is, and kind of how you got to this position, starting as a pharmacist and moving into this arena?
Sure. Not a pharmacist, but our story begins actually back in Israel. Omri, Israeli name, Israeli born and raised. And our story begins about 8 years ago. My father is diabetic and hypertensive. And one beautiful Saturday, we were barbecuing, and he asked me if I've seen him inject his insulin today. And I gave him a very straightforward answer. I said, no, I haven't. But what he understood is that he hasn't injected his insulin. So he injected what was a second dose of insulin at that point in time, fast-acting insulin. And a few minutes after, he looked a bit pale. So I asked him what's going on, and he wasn't too responsive. He was at 38 glucose. 32, 30 is a diabetic shock, so he was pretty close. And we were fortunate enough to catch him on time. We loaded him with glucose and sent him to medical attention, and he's doing great today. So he's Medisafe user number 1. That's how we started the company. But during that time, we understood the extent of mismanagement of medication. So just to give us some numbers, so according to the Congressional Budget Office, mismanagement and non-adherence to medications cost the U.S. healthcare economy about $290 billion a year. That's with a B. And 700,000 people a year suffer an emergency due to mismanagement of medications. Unfortunately, 125,000 people a year die because of that. That's a huge public health issue. And we're trying to solve that for many patients. So from this one father, we have today 7 million registered users. We're considered the number 1 medication management solution app. And on the other side, we work with many of the partners in the healthcare space, specifically pharma companies. About 8 of the top 20 pharma companies work with us. And as you alluded to earlier, we create inside Medisafe digital companions for their drugs. So that's the business that we have.
It's phenomenal. Week after week, we hear stories of people who have been so completely successful, but really it is that original story, right? The story of origin as to why you do something that really leads you to a place like this. That and of course the talent that you bring to the table. So the idea of a digital companion, now you've said it, and I'm very excited for our audience to hear about it. And I know you have a hard 12:30 stop today.
I'm very excited too. I want to welcome just some comments from the audience. Thank you, Janice Lee. Very excited about the future of the pharmacy. Great guest. Sorry, this is meant to be a little bit interactive.
We love this. We love this.
And Gopal Trivedi, keep up the good work. So, okay, go ahead. Digital companion.
Digital companion. So maybe do you want to show your video so that people get a sense of how this works? And then we can talk a little bit about digital companions and what that's going to look like in the future.
Sure thing.
These days, managing medications takes a lot more than simple reminders.
Is this a glitch on my end, or?
Oh, sorry. We're ready for the video. Did you want to?
I think yes, we could. I think we can do it. Omri, you want to give a
These
preface
days,
to it,
managing medications takes a lot more than simple reminders. From navigating complicated approval processes and treatment instructions to juggling multiple medications, it can all be pretty overwhelming. This is the inspiration behind Medisafe's digital drug companion. It connects your patients to the day-to-day support they need just when they need it, keeping them engaged and on track with their treatment. Millions of people rely on Medisafe to manage their medications in their everyday lives, resulting in daily use rates similar to that of Facebook, Twitter, or Instagram. But the digital drug companion takes this to a new level. Within Medisafe, we create a robust experience with your company's branding that holistically supports your patients through their entire medication journey, from navigating the barriers to getting treatment, to guiding them with AI-powered interventions that help them stay on their therapy schedule, to helping them harness resources like financial support programs and home delivery. We can even help connect them with their patient support teams, caregivers, and clinicians. Powerful tools let you easily design an experience that automatically adapts to every patient's unique needs. It's like putting all your patient support programs right in the palm of their hand, supporting them at every stage of their journey. The result? By digitally connecting patients to treatment, our top partners realize an average lift in patient adherence of nearly 15%, which means increased revenue and, more importantly, engaged, healthier, satisfied patients.
And that was it.
So that patient engagement increase is impressive, Omri. So for people out there, like, that patient engagement and the ability to really adhere to medications is so complex. I love that you have all of those different arenas, because it's really not, this happened this week. Who's going to pick up the prescription from the pharmacy? We're a doctor family. You would think that we would get there on time. We didn't get there on time. So 2 days of missed meds. And so everything from really understanding why you're taking a medication, how to deliver it, which is not necessarily easy. And I know Jen's going to pull out her albuterol inhaler at some point during the show. I'm calling it. But how to deliver something correctly. The diabetic administration, of course, being more complex perhaps than some others. But then also remembering, did I take it or not? Do I take 2 or not? This happens in cardiology all the time. Patients saying, Doc, I don't know if I took my dose or if I missed it. Should I take it again? And so these kind of questions and being able to remember. And then the actual delivery, right? Getting that medication to your house at a time when you can then resume the next dose and you're not standing with empty pill bottles like I was earlier this week. These kind of things happen. So where and how do we define then this idea of digital companionship? How is this going to get to everybody? Like, I would love this for my life in general, never mind just medication. Wouldn't it be great if for everything I do, someone took me from beginning to end to make sure I didn't miss parts along the way? What does the future of this look like to you, Omri?
Yeah, so let's paint a picture. Let's look 5 years forward, right? So if actually, let's look at today. What's my financial companion today is here on my phone. It's my bank. My bank today is here on my phone. I just open it up, and if I need to wire money or what's not, this is all being done on my phone. If I used to have a travel agent, not to talk about the fact that I haven't traveled for so long, but my travel agent is the United app on my phone. And we're seeing that consolidation happening in other industries. And I think that if you're looking 5 years forward, my medications, my pen injector or my pill, they don't communicate with me. They're not interactive. So can we create an envelope of services, either digital or human, that will be able to manage through this entire healthcare process throughout the journey of the patient, from the moment that they get prescribed for the first time and throughout the entire journey. So that's what we're creating inside Medisafe. We already have a few of our partners that are working with us on that. And I think that alongside each and every molecule, you'll have a digital code that will work with the molecule as we're looking forward into the future.
So, and Jen, let me know if there's audience questions, because I know you're watching that and I'm not right now. But so a question for you, because you did talk about companies using Medisafe and revenue generation and capture of patients. Let's say I give somebody their beta blocker, their statin, their ACE inhibitor, their SGLT2 inhibitor. They're taking a bunch of different things and they're all from different companies. Does that all come together in one unit and one clear package with Medisafe, or will it in the future?
Yes, correct. So it all comes together inside Medisafe for the patient. And some pharma companies historically, maybe 5 or 8 years ago, created their own apps. You actually mentioned one of them at the beginning, the one with the injection and with the vaccine. And when a pharma company creates an app, it's really focused around their own one therapy. And then your patient is taking, typically cardiology patient, 7 or 8 different medication. Does it really make sense that they'll have apps from all the different pharma companies? That really, that's not a good experience. So what we do inside Medisafe, we bring it all together while being able to create for the more specialty types of medications their own, think about it like a premium experience inside Medisafe. So you have all of them covered, but you still have a great experience for more of the specialty meds.
That's great. And I'm told that it's not a very interesting subject, but I'll ask a quick question before we bring Timothy on next as well, which is how important is health literacy and digital literacy for this? Because we are making sure to focus on the digital divide, on equity, and that, this is not something that's just going to be available to a slice of the population. How important is health literacy? How important is digital literacy? Is that encompassed in the company? And are we able to get this to, people from all different, strata of life?
Yes, I think that we're getting there. So when I started the company back in 2012, I remembered the investor back in Israel that said to me, 2 of them. One of them said, this is not relevant for the target population. And I think that today it is. I think that we have a majority of folks that are currently on already on mobile device, even with various areas in socioeconomics. And then inside Medisafe, we bring in everything that you will need as a patient. So even things that sometimes pharmacists unfortunately can miss, because they in many cases will treat a certain area of your healthcare, but not overall. So Medisafe can identify drug-to-drug interactions. And just recently, we got an email from a patient saying that Medisafe literally saved their life by identifying an interaction. So we have that as well.
Fantastic. Well, so, you're talking about pharmacists, and this happens with physicians too. We think about, one area and how can you be able to talk about everything? And that's where algorithms, that's where some AI in the future is going to come in and really help us. So maybe we should bring on Timothy next, Timothy Aungst, the digital apothecary, because I think one of the topics that we will talk about with him, along with many other things, is also what is the future of the pharmacist look like, and what happens now when these apps start doing their job for them. So, Jen, shall we bring on Timothy?
Yes, welcome, Timothy.
Hello.
Welcome, Timothy. Timothy and I have known each other for a long time. This is the first time I think we've really spoken in person. Timothy, you want to give us a little bit of background about you and the digital apothecary and why? And if no one's seen the digital apothecary, it's amazing. So Timothy has fantastic content, comparisons, and videos. Go ahead, Timothy.
Sure. So my name is Timothy Aungst. I'm associate professor of pharmacy practice. I'm also a clinical pharmacist. Previously, for 5 years, I was outpatient heart failure management at UMass, and now I'm home healthcare, or was until people don't want us to visit in their homes right now. So we'll go back to that eventually. Along with that, I am a digital health, expert, or whatever you want to call, in digital therapeutics, medication adherence, combination products, as clinical trial design, service advisor for multiple different groups and companies such as Health Excel, and for the Digital Therapeutics Alliance. So if it's pharmacy related, basically, I can be your go-to guy for digital health at this point.
Love it. So tell us a little bit. So digital apothecary, how many years? And as you pulled this all together, you really started in the world of kind of med adherence, med optimization, right? That was your like pharmacy clinical, that is your go-to. Everybody in the pharmacy world knows you for that. And then you took that kind of typical pharmacy course and said, hey, look, hold on. The entire world is moving in directions. There are different companies starting to do digital pharmacy related things, and we need a voice. And I feel like that's when we started seeing the digital apothecary come up. So what has that been like for you? And then I guess as we're thinking about it, some of the people out there are not only entrepreneurs or clinicians, but there's even VCs. I strongly urge the VCs to take a look at the digital apothecary, by the way. The way that Timothy thinks about this and categorizes things is phenomenal. But as you're talking to our audience, kind of let us know what flavors, how you think about things as the digital apothecary.
So, the one biggest thing is I've been trying to use digital health as an avocation for our profession to find new ways to basically create roles for herself. And I'll come back. Look at this whole conversation we've had so far. So you introduced like the whole issue about vaccines and said, call your doctor. No one's talked about, call the pharmacist or talk to the pharmacists that are doing a lot of these vaccinations.
Okay, Ami, he called you out on that.
Yeah, sorry. On the pharmacy day.
Yeah, but
much respect.
I would have advocated for calling someone, not me.
But also along with that line, then also, Omri, talked about drug interactions and, the fact that his app can do those things. Meanwhile, clinically, what is a drug interaction? There's multiple drug interaction checkers out there. There is no set thing saying what is a significant versus insignificant. You make it up as you go along, whether it's Elsevier, Walter or IBM, they all decide what they are going to call a drug interaction. They could be theoretical, they could be practical, they could be case studies. So, the idea that we have all this technology coming together to solve problems that pharmacists, kind of have professionally done, I think is quite interesting. I think a lot of people like medication adherence, because my thought on this is everyone was kind of saying, it's a $300 billion problem, and all we need is one technology to solve it. And early on for me, I looked at it as like, man, you guys really know how to get the VCs just clamoring to send their money to you guys, because it's not medication adherence is a problem, it's medication optimization. And Omri, I think, hit this too. But the fact of the matter is that we do have this viable profession out there that have, 40 years of experience talking about doing this. But yet we're still going back to technology as this one, place end all be all solution. And this is where I've been trying to work with investors, VCs, and other people and founders is that, everyone really doesn't understand, what pharmacists do in the pharmacy environment. And because of that, most of the solutions and most of the money has been pulled around how do you get, the drug to the patient faster. And that's why we see companies like Ro, Hims, everything else comes up, TruePill into being there as an open API for these companies. We see a big push talking about PillPack and people are like, bam, that was a pharmacy answer. That was it. And yet you look at us and you say, but there's been almost little to no companies that have actually leveraged the cognitive ability of a pharmacist to actually develop and deliver services that would actually help the patients at the end of the day with the optimization. And what I would say to this is the fact that we have years and years and years of research. Like pharmacists don't need to show research showing that we can make a clinical difference. That's a waste of money. Like we have 40 years of that data. The problem though is the financial incentive, whether it's value-based care payment model going into different things such as Village MD. And I'm quite interested if they're going to go down that whole IPO SPAC path, or who's going to basically say, wow, we have a 300,000 plus pharmacists out there that we could use to help out with, as Robert said, huge public health issue. And, what resources or technology do they need to actually deliver that? There's a huge focus talking about, how do physicians' workflow be empowered? How can we use telehealth to physicians see more patients? And yet very little about, how do we get the pharmacists to be able to do some of these things? And that's really where I think for myself, what I'm trying to fight for.
I love this because I think it mirrors a lot of what we're talking about. Jen is trying to get some comments in from the audience. I think I see the finger. I know to recognize that.
I am the finger. No, that was really passionate. And I think I would actually like to have Omri have an opportunity to work his way in. And also, I think we should respond to that because I don't want to make you feel like an outsider. I love my pharmacists. I had teams with pharmacists that would round with us, and I thought they were amazing. I was like, why don't I have a pharmacist round with me all the time?
Yeah, but so here's the thing. Notice that you said round, and we do the same. We round up on the floor, but John Marshall from Mass General, God bless, good friend, one of our heads of pharmacy, and I have been talking about how about the outpatient setting? like, where is that connection in the outpatient setting? And when we first started thinking about it years ago, it was a physical concept. Will there be a pharmacist there? And now I listen to you, Omri, and you, Timothy, and I think, gee, we're not thinking about it the right way, right? It's how are we going to interact across and over our patients in that spectrum? Omri, thoughts from you about that engagement?
The VA, we have outpatient pharmacies, and they have meetings and appointments and management. So can I deliver Timothy in an app? Or Timothy's like, I don't need to be in an app. Or maybe you could be.
There are some companies looking to do that. There's a number of pharmacy startups that are trying to do it. And I think those are really, for me, where I really think that this may be the way forward in some kind of capacity at some point. I mean, the VA system I love for pharmacists, but the VA system also has VA money, which is not representing the overall United States, unfortunately.
Well, maybe you keep advocating. We do have some viewers. So thank you, DK, from watching from Finland, working on deep tech. I don't know what deep tech is. Maybe the tech people here will tell me what deep tech is, or maybe DK will tell me what deep tech is. And then we have a Harvard student, Nicole Zhang, who has a bunch of questions that are coming up. So we'll post them later. But Omri, I'll let you respond.
Yeah, so our goal at Medisafe is not to replace different areas inside healthcare, but we want to optimize and we want to be a connector. So my goal is to be able to empower the patient and then take the data and put that in the pharmacist's hands, in the physician's hands, in a way that they can do their work in a much better way. So I want to fill the gaps. Tim, we can talk about a lot about pharmacy, but really that encounter is, maybe 10 or 15 minutes inside a month of the patient's life, right? So I want to fill the gaps throughout that entire month with what the patient needs are in terms of literacy, in terms of solutions, in terms of the process. And, Jen, you're going to see the patient typically every 3 months or even 6 months.
In the ER, I only see them if there's a problem.
So then I want to make sure that the in-betweens are filled really well. With everything that patients
use them every 3 to 6 months.
No, but that's exactly right, Omri. That's that idea of episodic care, which is actually not ideal. We really need continuous care, and the fact that that's what we can rely on our colleagues and work together across kind of disciplines to do is perfect. Timothy, you're just dumping like losing things left and right there. What's happening?
I heard there are 2 new children, 2 new babies that could be contributing to the situation.
As long as he's not dropping the babies, we're okay.
One of my shelves just actually fell off my wall.
Oh no!
So that's interesting. Well, you can see this is the first for you guys then, so it's kind of fun. Sorry if I blew out your ears.
No.
Omri does have to leave soon. I know Nicole has been posting. I don't know what Nicole is doing at Harvard, at Harvard University, but she has a lot of deep questions. So specifically, and she posted them. Omri, I don't know if you or your team can look at them, all the questions online, if we don't get to them today. So Nicole from Harvard says, when onboarding new users into Medisafe, what are ways that friction can be further reduced? Adding meds and dosing schedules one by one can be tedious, and not everyone can import from Apple Health. I don't even know what Apple Health is. I'll read up on that.
So Apple Health essentially mirrors on the patient side what you have inside the EMR. So you have Epic or Cerner in the VA, I think. And then the patient can
not yet. Cerner eventually, maybe if things don't go right. Go ahead.
So Apple Health is able to do that, and then Medisafe patients can go in and say, "Hey, pull my medications from Apple Health into my Medisafe." So that makes the process so easy. But indeed, you do need a certain level of technology orientation in order for you to do that. So that's correct. But imagine a future where you have the prescription and you have that slip that is being stapled, and then inside that you have a QR code. You scan that QR code, and all the medication information is then moving into your Medisafe. So that could be really easy. But but we're not yet there in terms of the healthcare industry. So it will take us time to do that.
I think the suck out is difficult. Oh, and Omri has to leave. We have Ben Lam also who has another question. Sorry. How does Medisafe ensure patients taking the right meds, the right dose, and the right time? I think those are great questions. And maybe this is your last question, Omri, and then you have to leave. I know.
Sure.
We'll let Tim and me and Ami answer questions. Now Omri's like, oh no.
You'll continue the fun without me, I'm sure. So for this one specifically, we'll give notifications. We'll manage through the process. Interesting point. We didn't speak too much about research, but one of the research that we have, we've been able to match patients between their Medisafe, so their digital presence, in a HIPAA compliant and a de-identified way against their claims data. And what we saw is 95% correlation between how patients report inside Medisafe and how their real life presence behaves. So we saw that, it's funny, people speak about the fact that patients sometimes, you're going to ask them if they're taking their medications and they're going to say, sure. And that's not going to be the case. But to Medisafe, they're actually telling the truth. So that's pretty cool. And if you think about Medisafe enabling the patient, clinician, pharmacist, physician, nurse communication in a much better way, potentially now you'll have much better data to work with.
Omri, two really quick questions, and then we'll let you go. Sure. So one, when the patients have a certain insurance plan, there is maybe Zocor is better than Pravachol, right? There are different drugs that are better. Are you guys able to engage with that or planning to be able to do that? And then the second is there's a lot of evidence in terms of social determinants of health and at-risk populations that when the community, the father, the sister, the best friend is aware of what meds you're supposed to take and is somehow highlighted to it in a HIPAA compliant way, you're more likely to do it. Could you quickly touch upon those before you go?
Sure thing. So the first one, currently this is not on the roadmap. There are certain things that we do leave for healthcare professionals. So, you guys know much better than us, and you're able to empower the patients around the decision which meds should they take. We do not give any medical recommendations whatsoever. And because of that, we don't need to be FDA approved. So that's one point. To talk about the second one in regards to family connectivity. So when we started Medisafe, we said, well, just reminders are not going to do it. We need to think creatively for what else should we add in. The first feature that we added, maybe because of the experience with my father, was the concept of MedFriend. So in Medisafe, you get 3 reminders, and after essentially it turns out to be 30 or 40 minutes after the time that you're supposed to take your medications. If you've set up a MedFriend, they will get notified that they should contact you and make sure that you've taken your meds because you haven't reported inside Medisafe. It has shown to be extremely efficient way of making sure think about it as a fail-safe feature. So that's MedFriend inside Medisafe.
That's fantastic. Well, Omri Shor, CEO of Medisafe, thank you so much for being with us today. We're going to have to bring you back in the future. There's so much more to discuss, but really appreciate you taking the time.
Absolutely. Thank you, Amy. Thank you, Jen. And Tim, it's been a pleasure to reconnect. So thank you. Appreciate the time. And you're doing an amazing service to the healthcare industry by creating this engagement. Appreciate it so much.
Really appreciate having you on.
Take care, Omri.
Thank you. Bye-bye.
Tim, we're putting you in the hot seat. This is it.
That's no problem. I'm used to that.
So I think Jen is going to...
but Nicole says thanks.
Excellent.
And Nicole's working on a MedTech device to improve adherence and compliance for controlled substances.
Excellent. Thank you for your work, Nicole. That is an area where we need to be able to do that. So I think that's excellent. Congratulations. I would love to see, and I'm sure there are questions, but Timothy, you have some cool gadgets. You have some stuff. Can you show any of it? What kind of the pill dispensers of the future or the inhalers? Or can you talk about, yes, That's what I wanted to show everybody. Thank you for sharing. I wasn't sure you were comfortable.
I have to go into the blow up Tim screen. Okay.
So what ended up happening was I had these lights on my wall, and one of the panels fell off and hit my shelf. And that's what basically that big bang was. So apologies.
Well, I'm glad it wasn't a child falling, so that's good.
No, they're upstairs. I think they're banging and jumping upstairs, and that's what caused it to fall.
To anchor with normal pill dispensers, I have an albuterol inhaler.
I knew you were going to bring it out.
So
only use it when someone suggests I climb Mount Washington. Otherwise, running 5-10 miles at sea level is not a problem. But this is boring. Can this be optimized, Timothy? And then I also have a squirt spray because I have also
I have that too. Yeah.
Allergies. So I sometimes forget how many squirts I've had. But
all right, Tim, let's see it. What do you have?
I mean, like, the albuterol inhaler, we've known that there's been a bunch of sensors you could put on to help track. So, like, if we're talking about someone with COPD, asthma, and everything else, and you're looking at actuation, so we do have, like, things that you could put on. Adherent was one. Propeller is a different one that's now owned by Respimed, and that was required for, like, $600 billion, I don't know, or million. It's a lot of money. And those are useful, especially from like a managed care perspective, because if I'm a pharmacist and I'm back there and I say, oh, wow, you use your SABA like, 10 times today, maybe I should inquire before you go off to the ER and figure out what's going on, right? That reduces costs, and the payers actually are very interested in that. So things like that are useful. In your case, Jen, with probably exercise-induced asthma or something like that, it's kind of be like, oh, they use it one-off, and if they keep doing it, maybe I should follow up with them, especially since they only use it like 4 or 5 times a year. Now they suddenly increase. Is that demonstrating that maybe her asthma symptoms are getting worse, and we should follow up with that before she actually has an incident? Things like that. That data, I think, and I think Omri it was very important saying is that we're moving towards an intermittent care model, towards a continuous care model where the data is very valuable. And around medications, it's very helpful. So there were some questions posted. I remember, like, someone asked, like, what's the difference between like a smart pill bottle versus a pill dispenser? For you, this would be like a smart pill bottle, like just one. It goes off, it rings. Oh, go ahead.
Break it down. What is this?
So there's tons of these out there.
I've never seen one. I don't
Great.
own one. I don't know where to find one. You need to come visit me in the ER and show it to me.
So this one's from Pillsy, so it will alert and such and go off. I have YouTube videos out there comparing them if you guys want to look and read them more and my critiques of them. But like I actually tested, I had like 6 of these going off at one time in my house, and then my wife was like, kill them, stop it. That was actually one of the big weaknesses of having these types of things, is I didn't realize like what it'd be like to having that many alarms going off at once.
So the actual pill bottle will alarm if you do not turn and open it at the assigned time that it has been programmed to. That is what's happening with that pill bottle.
Yes, and one critique I would have is still subjective data, because I've actually tested this with other people, and some people will just open it and close it back up and make it shut up and not take their medication.
Mm-hmm.
We do know that happens. I call it the flossing effect, where patients know that if you're gonna like even take blood draws of their blood levels, they'll start taking medications beforehand, kind of like people floss before they go see the dentist, but doesn't mean they're all the time doing it, right?
That's me. I've been known to do that. It happens.
I don't do that.
So is there a chance to any of these, either the pill bottles or the inhaler you showed us, instead of just having the count on the inhaler on the pill bottle, do they connect Bluetooth to a phone or to a system where someone can keep track or see it?
They practically all do at this point.
Yeah, do now. Okay.
And I'm actually going to bounce off Nicole, saying your post. If you're looking at controlled, there's actually about 4 or 5 devices that I know that are under studies right now. About 4 of them or 3 of them have put out clinical trials and looking at this. Some of them have actually gotten funding from NIDA, which is National Institute of Drug Abuse or something. I can't remember what it's called, for substance use. And they're actually funding some controlled substances for these devices, and actually they lock up, and you can only like dispense so many drugs at a time. That's been used for controlled substances. So that area is a very hot topic for the past, I would say, 4 years right now.
That's great, Nicole. You're in a good space.
It's interesting with that versus there's more the embedding something into a person to actually detect if they've ingested it and if they're hitting optimum levels of the drug in their blood system. I don't know if now it's a time to do a deeper dive into that, but
I mean, if we bring back up for deeper dives, I mean, each of these can be a huge deep dive, just because there's so many players at scale, and the biggest question is always is payers. Why would I pay for this technology? What to utilize it for at the end of the day? That's where these companies have to show evidence.
And so if you're looking at these kind of options, I'm sure they exist for a lot of things, and just lacing or tracing a pill with something so that you can see that it was ingested, right? Is the idea that Jen's talking about for those who haven't seen that before. What do you think, Tim, is one of the most exciting things on the horizon that payers may actually engage with, that does provide, right? We're moving towards value-based care everywhere, that does provide value. Do you see something either late or early stage that you think is promising?
Yes, I mean, I would say it comes down to the molecule at the end of the day. I mean, pharmacokinetically, if you miss some drugs, it's not going to kill you, I would say. We know some drugs are much more dangerous to be non-adherent versus adherent. Like, if we talk about anti-coag, insulins, we know that anticoagulation and insulin medications are probably the top 2 reasons that people over 65 get admitted to the ER, for instance. So I always think about efficacy versus safety perspective. So monitoring from safety, that's why we see like CGM technology take off and everything else like that. I think what we're going to see is like Eli Lilly, Novo, and other companies come out with smart insulin pens. I think that's going to be a market shaper right there. We'll also see smart auto injectables. I would say we'll probably see smart other pills come to market. I think it comes down to what that molecule means. Is it so that if they're not adherent, that a payer would say, I have to pay a lot more money. Let's suppose we had, for hepatitis, we know that you need an adherence level so much, and if you don't accomplish that, you fail. And if you fail, how much money was invested, and then also, what's your resistance pattern that could come up, and what was it worth paying a few $1,000s more to ensure that the patient was adherent and not failed at the end of the day. Other things like a statin, does anyone really want to track that? Maybe, maybe not.
It's going to be in the water soon enough. So, it's fluoride in the water. Statin is next.
I'm going to put in my catch up.
No, that's spoken still by a cardiologist.
That's true. So, it's interesting. I think about our transplant patients, though, right? And that is an area where really, and it's timed meds too, right? We don't want to see, we need immunosuppression to happen in a certain way. And so we need timed meds. I was a counselor for a camp for kids with congenital heart disease, and we used to transplant kids. And let me tell you, teens who have had a transplant, waking them up at 7 a.m. at summer camp to take their meds, banging on doors. And so, I think, but it's really important. And if you think of how much cost goes into transplant, we really do want these people to both do well, but it's also a large cost to the system. So, Tim, you have something for this. You're ready.
That is huge. I am sorry, just going to be a timekeeper. We have like 1 minute. I want to show some questions we didn't get to. Offer to have Tim and Ami and all of us answer it after the case. We have to close up in 2 minutes. Go, Tim.
So Veka is another Israeli company. They made a smart pill container. They actually tested this in kids, and it was for post kidney transplants. Was very successful. The one thing I would say is they were really good in terms of using that data for health coaches to actually then talk to the kids and their family about why they were not using their medications and help fluctuate their basically how they were taking the medications. There's been a number of research to your points that have shown positive or negative results that we can learn from and utilize.
That's great.
So I think that's great. I do want to encourage all the great questions that came in. We have Dr. Susanna Scaglione from Uruguay. Do you use VR? I don't know if we do use VR. I think, Tim, you're probably going to be like, and by the way, back here in this drawer. Okay, we are. And then we do have one other question from Kanupriya Daga, student at UGA pursuing her master's in biochemical engineering. Thank you for joining us today. The digitalized pill bottle is amazing. Can you comment on the economic feasibility of such technology? I guess that's Tim, or maybe we should have someone else join us. I mean, economically, I think it's there. If we have companies, venture capital. Go ahead, Tim.
So the one big thing is that if a payer takes it and reimburses for it, or if a pharmacy uses it and puts on the caps themselves. There is one company right now called PatchRx that's out there that's trying to do that and work with pharmacies and doing it. Other ones like AdhereTech and everything have standalone devices that payers back up and pay for themselves. So it does vary.
So really appreciate all the comments from everyone. And I love this conversation. We're going to have Timothy back on again, and hopefully Omri as well. Ami, you want to say some closing thoughts? And also big shout out to Ami and her recent publication. I think you've seen it circulating on social determinants of health in a European journal of some sort. Sorry. Ami, how would you talk about it?
Just throw the word heart in, European Heart Journal. It's their digital health journal. And thank you for that. It's exciting to be able to highlight where telemedicine goes right, but also to admit where we go wrong and which areas we need to focus on. And that was in the United States, in our area, it was Black race, Hispanic ethnicity, our elderly patients, and those with low SES. So just the areas that we're trying to make sure we get to with our conversation today regarding pharma. Timothy, I just want to say thank you. The Digital Apothecary, the work you do there. For those who haven't seen Tim's videos, they are engaging. You will learn about areas that you didn't even know could exist. I do think the value proposition, I think the economics of it are going to need to be something that we think about. But I am pretty sure as we started this discussion, with the amount of money that's out there going into digital tech, I think if it didn't go into digital pharmacy, we would be doing a disservice. So, hopefully we'll watch this area grow and have you back, Tim. Last word to you.
Thank you. No, I appreciate it. This was very fun. I thank you for inviting us. It's good to catch up with you, Jen, finally, after a few years. We'll have to do that again once this whole pandemic thing petters out, I hope, with the next year.
Fingers crossed.
Thanks, Tim. Thanks, everyone, for joining us today.